Hi, I'm Dr. J. Franklin Shults. I want to talk to you today about crisis intervention. And this is going to be a special. You're going to get four different benefits from today's discussion. My wife and I were at the grocery store the other day and we saw this stack of cereal. It was a brand we didn't particularly care for and didn't eat very often, but it was buy two, get three free. And so we ended up getting 5 boxes of cereal because it was such a bargain. Well, you're going to get that kind of bargain today. The main reason I want to talk to you about crisis intervention and how you can be effective by using the 6-step crisis intervention plan. And if you want to go to Google and Google crisis intervention strategies, then you'll come up with probably lots of different templates. But this is one that I really like. I've used. And when you use something that you know is effective and is best practice and the professionals use it and it's taught out there in the crisis intervention world, you can go away from a scene saying, I did all I could, I was very professional, I did all the helping I can do, and now somebody's on the path for something good. And that you may not have a happiest of all outcomes, but the main thing is I want you to be able to, using this method, feel confident as you walk away from a scene, no matter what the outcome, that you did all that you could so that you won't be racked by guilt and regret and have some performance issues and anxiety the next time a similar situation comes up. So that's the primary reason that I'm excited to talk to you about the 6-step crisis intervention model. But the second of 4 is that it will indeed be an effective helping model. A friend of mine went to a fatality accident many years ago. A man was driving and his 12-year-old daughter was in the passenger seat. He went off the road and the 12-year-old was killed in the rollover. And my deputy friend was the first one on the scene. Trooper arrived to take care of the accident investigation. And my deputy friend had the driver, the father of the deceased child, in the car with him and just did not know how to deal with this very traumatic situation. So he started talking about football to try to get the person's mind off of it. And sad to say, he was just completely unskilled at dealing with this kind of crisis. And so this method might have helped him be a more effective helper. So it's going to help you know that you've done the right thing. Secondly, it's going to actually help you be a more effective helper. Thirdly, it will help you know how to deal with your peers, with a partner or someone on your squad or somebody that's retired or a police friend or anybody in the first responder community. This is a way that you can use to reach out to somebody who may be in a crisis. And the fourth thing, and this may be of more interest to some of you than self-care, is that it would be a very helpful model that you might want to experiment with when you're interviewing witnesses or even interrogating a suspect. Because in those cases, and I want to talk particularly about somebody who's a suspect, they are in crisis. They're facing a big life decision moment about whether to talk to you. And so if you become someone who they feel comfortable talking with, you're more likely to get some admissions, some inculpatory statements, and perhaps a full confession. So let's talk about these 6 steps. Step number 1 is define the problem. What's really going on? Many times we don't realize all of what's going on in a circumstance. We get the radio call or we see something on view. We never know the context of the whole background. And I'll give you a couple examples of misdiagnosis. I once went to an accident scene. The little boy was about 6 years old. He was in the back seat. It was a snowy day at the bottom of the hill. There had been several crashes. The mom was being hauled out of the car, strapped down, screaming in pain on the gurney, getting into the ambulance, and the little boy was just back in the back crying. So what did I define as the problem? I defined the problem as, here's a scared little boy that needs some comforting. So I picked the boy up and I took him over and let him ride in the ambulance with his mom. Well, turned out the kid had a fractured femur, so he was not only in emotional shock, but he was in physical shock as well, and of course moving him was absolutely the wrong thing to do. And so I misdefined the problem. Fast forward a couple of years, I was at a cafeteria table in the university where I was teaching, and a colleague came up and he had his shirt inside out. He wasn't very responsive. He seemed very droopy, very low energy. Well, I happened to be sitting next to a psychology teacher who was a counselor, And as I talked to my colleague, the counselor was trying to find out why he was so low energy and why he was depressed and why he seemed to be disoriented. And I began to think, hey, I happen to know that this guy's got some diabetes issues. And so I called an ambulance, and his sugar was like way off the charts, and he was actually pretty close to a real serious diabetic emergency. And so there again, we want to make sure that we're not diagnosing a physical problem as an emotional or psychological one, and vice versa. And the problem may be a problem of abandonment. It may be a transitional crisis, post-retirement or after surgery or after divorce. But make sure that we're addressing the problem. And we do that by listening, by active listening, by giving feedback, by not putting people into a box, let them reveal. I know this takes time, and a police officer on scene doesn't always have time to do this. But the more that you can listen, the more accurate you can define the problem. Step number one, define the problem. Step number two is ensure the safety of the individual. Now, if you want to go back to this interrogation thing, what is this person's problem in terms of what would keep him from being truthful and confessing? So if you know what that problem is, what makes that a crisis for him, then you can begin these other 5 steps in the interrogation process. But back to the crisis intervention process. The second step is to ensure safety. Get the person out of the danger zone. You should really just ask, do you feel safe right now? Do you feel like you might come to harm? If it's a domestic situation, do you feel safe staying in the house tonight? And you can ask them. Sometimes we say this with colleagues, and I saw this in a response to an article on Police One of the comments, and I thought it was very good. I should give attribution, but I can't remember who made this comment. But he said, at a scene, you're at a disaster, or death, or SWAT call out, and you're kind of on the downside of that adrenaline rush. And he says, typically people say, are you okay? And of course, that's a binary answer. I'm not going to say I'm not okay because, dadgummit, I'm a cop and I can handle it. So, yeah, I'm okay. But he always says, are you 100%? And then people can kind of scale that. And they say, well, I'm surviving. I'm at about 50%, or I'm at 80%, or I can make it through this operation or through this shift. And that gives you a much better picture of how safe they feel. How safe do you feel here tonight? So you make sure and get them to safety. You can assure them that, okay, I'll be with you, or we'll try to make some arrangements to help you feel safe, or we're going to find a place for you to stay tonight, and get them away from it. If their house is burning down and you can keep them from being right there in the midst of it, and maybe move them to a safer spot, ensure safety. And that's not just physical safety, because that's going to be very natural for you to do that. And we'll risk our own safety to pull somebody to safety, but also comfort, emotional safety, feeling like they're being cared for. One of the things that people think about when they're going through this traumatic experience is, man, I'm going crazy. This is out of control. I'm not going to survive this. And if we can assure them that that's quite all right, I would certainly feel that way. That's very normal. We'll work through this. Now, you notice what I'm not saying. I'm not saying, oh, everything's fine. I'll be absolutely sure that nobody hurts you. I'm not going to make these global, futuristic promises that I don't know if I can keep, because I may have to hand this person off to somebody else that's really going to continue that safety process. So I'm going to say things like, I'm here right now, you're safe right now, nothing's going to happen to you right now. And so you make it very immediate. And you also need to repeat things, because their mind is going to go a million miles a minute, or they're going to be like getting close to shutdown mode. And so it's like, sit down, let's have a seat. I'm here, or how you doing? I'll be with you. So that's part of step 3, provide support. Emotional support, or if it's some kind of need that they have, some transportation, taking care of their pets, making sure their kids are okay, contacting somebody to come over and watch the house. Provide some support so that they can, what all that does is that helps a person eventually get back to a little bit of rational thinking and out of that survival crisis thinking. So when you validate that they have that they're in crisis, and you agree on what the problem is that you're going to be approaching and solving, and then ensure their safety, provide support. Then they're going to be able to do the fourth step, which is to examine alternatives. Okay, so what's the problem? Make sure you're safe. We're going to provide support for you, and now examine alternatives. What are we going to do now? And of course, in some interrogation methods, if we go back to the interrogation issue as a crisis, we want to maybe define some scenarios that they can accept as something that they're willing to admit or confess to, and then you can kind of fix that later. But we want them to feel comfortable enough to be able to explore some palatable alternatives that they're willing to admit, and those can often be very important admissions to you. But let's go back to the crisis intervention. And we often say, well, what do we need to do? I don't know. And we get very frustrated because the clock's ticking for us, and there's other things that need to be done, and we can't sit here and play social worker the whole time. But so often what we can do is to offer one or two or three different things. We can see if Red Cross can provide you some shelter. We can get a hold of a relative, or we can call our police chaplain and see if somebody can sit with you for a little while. Did one of those sound okay for you? Well, yes, I would like to talk to a chaplain. Okay, now we have provided some alternatives. We didn't just ask the global question, what do you want to do? Because they're overwhelmed and they won't know the answer to that. It's like asking your wife where you want to eat. I don't know. Any place is fine with me. So give some alternatives, and that becomes a binary decision. And they can say, yes, I'll do that, or I'm going to reject that, or we'll move on to that. And then you can make some progress. But it's also very important that when you're not just imposing a solution on them, okay, I'm going to hand you over to the police chaplain and let them take care of you. Now, that might be the right thing to do. You might have to be highly directive, and you might need to get that job done, make that decision for them. But for the sake of the person that you're helping, it's much better if they can be invested in the decision about what's going to happen. That will begin the healing process. It will begin to give them a little bit of control over the life. And it's really important, rather than just being told to sit here or go there, I'm going to refer you over there. I understand there are times you have to do that, but the best, most effective helping is to help them examine alternatives, some ideas that they can come up with, and they will eventually make a decision. Now, there's two more steps to this. The fifth step, remember, we're defining the problem, ensure safety, provide support, examine alternatives. What are we going to do now? And then make plans. Let me tell you two stories about when I was a college professor some years ago. And one time I was teaching in an academy. An academy student came up. We were talking about drug and alcohol abuse issues. And this academy cadet came up to me and said, Shults, I think that I may have a drinking problem. I'm listening to what you say, and you go through the signs of drug dependency, and I think I may be in trouble. Well, frankly, I was not prepared to do that. I had not done crisis intervention teaching. I hadn't been through any substantive training for that kind of thing. I mean, a real crisis, gun, knife, fire, something in progress, crash, blood, that I could handle very well. But something this deep and something that had some urgency but not like immediacy was something that I really found out that I wasn't very helpful at. And so what I did is I said, this was a Friday, I said, well, why don't you come back Monday and we'll talk about it. And that way I thought, well, maybe I can come up with something that might be helpful. Well, she didn't come back Monday. She actually was in a alcohol-involved accident. And frankly, I was never able to see her again. I don't know what became of her, because I failed to go through this process, and obviously I still feel guilt and regret about that. So a couple of years later, when I was a little bit better equipped to do that, I had a very similar situation. A student, we were in juvenile delinquency class, and we were talking about drugs and alcohol and other drugs, and this fine young student came up to me and said, Professor Shults, I think, from what we've talked about, I may have a drinking problem. So he defined the problem for me. And so the way that I ensured safety was to say, well, you know what, I appreciate you coming to me. We'll see if we can work something out. This is a good step. I really appreciate your maturity and self-awareness. So I was ensuring safety, that I wasn't going to condemn him or kick him out of the program, and I was providing support, so I was validating his recognition of the problem. And then we get to the examining alternatives question. And so I offered something to him, and he wasn't in immediate crisis, and so I was able to ask him, well, what do you think? What do you think we should do? And he said, I don't know. And I said, so I gave him one choice. I said, do you think it would be helpful if we had someone who was a professional at recognizing alcohol abuse sit down with you and talk with you and do an evaluation and see on a scale of 1 to 10 how serious this might be, or whether it's something that you can deal with pretty easily? He said, yes, let's do that. So define the problem, ensure safety, provide support, examine alternatives. Fifthly, make a plan. Make a plan. Where we often fail is we're empathetic, we listen to somebody, we agree with them, we pat them on the back, we provide support, we talk about some things that they might be able to do, and then we walk away and we kind of leave the whole burden on this person in crisis. So the fifth step is very important. Now we're into action plans. We went from assessing to action when we started examining alternatives. Now we make plans. So I said, and again, I'm trying to get him involved in the process by giving assent and keeping him engaged and making him responsible for his own decisions. I said, can I call the Alcohol Treatment Center right now and see if we can make an appointment? He said, yes. So I dialed the number. I said, hey, this is Joel Shults from, I won't say the university because I don't want to identify anybody. I have a young student here who's concerned about his alcohol use. Would you be able to talk to him right now and make an appointment to see an alcohol counselor? Well, sure. So I put the young man on the phone. They made an appointment. Now, we've done the sixth step, which is obtain commitment. So in the action, in the assessment, we have define the problem, ensure safety, provide support. On the action side, those three steps are examine alternatives, make plans, and obtain commitment. Shake hands, sign a contract. The way that I held this young man accountable is when is your appointment? Blah, blah, blah. All right, I'm going to call. Your appointment's at 10 o'clock on Monday. I'm going to call you at 11 o'clock and see if you made that appointment. Of course, if you're talking to another counselor and say, hey, did so-and-so come in for counseling? They're going to say, no, I can't tell you anything about it because of confidentiality. So, but I was going to hold him accountable by doing follow-up. That's the commitment. And again, that's often something that police officers, unless you're dealing with somebody you're going to see again, has a problem doing. You may want to do that in a way that passes it on to another a coworker or a peer support person or a mental health person or chaplain or a friend or family member, something to cement that commitment, okay? So once you've done that, define the problem, ensure safety, provide support, examine alternatives, make plans, obtain commitment. I'm going to assess, and then I'm going to do action with follow-through to get a commitment. Then you can walk away saying, that's on them. I did everything I can do. I provided services. I made referrals. I gave counsel. I gave empathetic support. And now we've got a plan of action, and it's really up to this person to pursue that plan of action. So I think that, A, that's going to make you feel better about walking away from that scenario. I think it's going to be very effective in helping. Thirdly, I think it may help you, even if you don't use it on the street somewhere, you might want to use it with a friend. And so now you've got a plan when somebody drops that bomb on you. I think I'm going to get a divorce, or I've been drunk the last 3 weekends. Now you've got a plan to address that. And fourthly, you look at this very carefully. And if you go through these steps and take the perspective that a suspect or witness, but let's talk about the suspect because you want to bust the case, right? That a suspect is in crisis, then you can use this outline, be that person's counselor, so it's something that they feel comfortable talking to you about. I found that that's easier. The older I got, the more paternal or fraternal or friendly I could be, because nobody wants to confess to a 21-year-old. Although there are some folks that use these kinds of techniques and are very empathetic, that are very effective regardless of their age. But I like to think that this gray hair is an asset. So hope that helps you in one or all of those 4 ways. You got a 4 for 1 today. Thanks for being with me again. I'm Dr. Joel Shults, registered psychotherapist here in the state of Colorado, law enforcement first responder chaplain, and retired police officer and police administrator. If you have a topic that you'd like to see covered in these little visits, please let me know. jshults@joelshults.com. If you are looking at my website right now, under the featured video or under the resources page, you'll see contact information for me at joelshults.com or streetsmartforce.com website. And if you want some personal contact, please feel free to reach out to me, and I'll be glad to be back in touch with you and see if there's anything I can do. And I'll probably be using this 6-step process, and you'll know exactly what track we're on. Also, do me one more favor. If you think that this might be helpful to anybody, whether it's an investigator, a peer support person, a chaplain, or another empathetic, caring person that wants to help people in crisis, please forward this link to them and invite them to be on my regular mailing list. All right, I'll let you go. Thanks much, and I hope that this helps you be a better person.